So what interventions or injections can be used in fibromyalgia syndrome? Well, I'm often asked this question, Doc, I don't want to take any medications, I've been on lots of medications before, I get side effects, etc., etc. And I explain to them the importance of the balance between benefits in terms of pain relief of any medications and any adverse effects. However, in some cases we can use interventional treatments to try and improve patients who have fibromyalgia syndrome. One of the commonest ways of doing this is the so-called trigger point injections. Now, I never advocate that patients have trigger point injections as a first-line treatment. We will always try and improve their global pain using medication or other treatments wherever possible. And if it happens that a lot of the tender areas, trigger points, tender points that the patient has, if the numbers shrink down and they're in some fairly concentrated places, then absolutely trigger point injections may well be indicated and may be beneficial. The real ways in which, there's a number of ways in which trigger point injections can be done. The first is to identify the trigger points, and usually we use a palpation, which is pressing around the areas with the help of the patient, or the patient and their physio or physical therapist can help them. And essentially we use an indelible pen to circle around the trigger point. We don't use crosses because if you inject through the ink you can get tattooing of the skin, so we use little circles to locate the trigger points. We clean up those trigger points with some antiseptic. We usually use chlorhexidine. And then to lessen discomfort we can use a cold spray over the trigger point, and then we can either inject a little bit of local anaesthetic into the skin, or we inject straight into the trigger point depending on whether or not the patient can tolerate the procedure or not. Some patients are incredibly sensitive to these types of injections, so you have to just be guided how they respond to that. In terms of what is injected into the trigger points, this could be simply local anaesthetic, short-acting or long-acting local anaesthetic, or a mixture of that. Often steroid preparations are injected as well. I tend to use a lot of Botox injections, and I use injections of long-acting local anaesthetic, things like bupivacaine and Botox. Botox has a lot of inhibitory effects on pain, and specifically for the trigger points in fibromyalgia syndrome, it will relax those overactive areas of muscle, and it also will be absorbed and go back to the nerves, to the central nervous system, where it has an inhibitory effect on pain. When we do trigger point injections, generally speaking, they are extremely safe. The potential problems with them are minor. These include failure, local bleeding, bruising, infection, discomfort. As I said, these are very minor and very unusual symptoms, but we do warn all patients before if they do have trigger points done.